Hello friends, today we will discuss some of the small topics in the surgery which are very important for our exam, such as the IV cannulas, Foley's catheter, and some of the scores such as the Glasgow Coma score, quick SOFI score, revised trauma score, etc. So we will see different mnemonics to learn them because they are confusing topics. So firstly we will start with the Foley's catheter. Foley's catheter. This is the Foley's catheter. In the Foley's catheter, we can see there is a two opening on the one side and the one opening on the other side. The two opening on the one side, for this one is the urine drainage port and another is the balloon port. From the balloon, fluid is inserted to inflate the balloon. So from here the fluid is inserted and it will inflate the balloon. When the balloon get inflated, it will help to keep the catheter in the position. So it is very important to inflate the balloon to keep the catheter in the position. And the use of the Foley's catheter is to drain the urine in the cases of the urinary retention, which can occur in the cases of the benign prostatic hypertrophy after the surgery, post operative, and it may be due to the trauma or strictures. And it is also used to drain the fistulas. So the color coding for the Foley's catheter is very easy to learn. So we will have to remember the mnemonic beautiful, gorgeous, white, gory from Punjab. So firstly we will start with the beautiful, which represent the black color. Then gorgeous represent the grey, then white for white, then G for green, O for orange, R for red, Y for yellow, and in the Punjab P for purple, and in the Jab B for blue. So we have to remember beautiful, gorgeous, white, gory from Punjab. And we have to remember the numbering also. So we have to remember that black is for the 8, then we will keep on adding 2 and 2 for all others. So lastly, which is the blue, it will end on the 24. So we have to remember this. The second topic for today is IV cannula. In the IV cannula, we can see that this is the cannulas, different type of cannula which is of different colors such as the orange, grey, green, pink, blue, etc. So these are the parts of the IV cannula. IV cannula has the needle in the front, and then there is a valve, and then the injection port cap we can see here, then the lure connector is here, and lure lock plug is there, so to close the catheter. The uses of the IV cannula is IV cannula that we have seen in the operative was OTs and also in the general wards. It is used for the blood transfusion, total parenteral nutrition, for giving different medicine which are the IV medicines, and for also for taking the sample on the regular basis. So if the person is in the IPD, then we have to take the samples again and again. So we put the cannula and take the sample from the cannula instead of piercing the needle again and again. So it is the use of the IV cannula. Now we have to see the color coding of the IV cannula, and we have to remember another mnemonic to learn the color coding of IV cannula. So we can remember there are two famous mnemonics. So the color coding start with the orange, then the grey, green, pink, blue, yellow, and violet or the purple. So we have to remember the mnemonic: O great God, please bless your people. O for the orange, great for grey, God for green, please for pink, bless for blue, your for yellow, and people for purple or violet. Or we can also remember another mnemonic: one girl give pen. One girl give pen, but why? Why for yellow? Why purple? So generally we ask for the blue or the red pen. So one girl give pen, but why purple? So we have to remember this mnemonic for the IV catheters. Another topic for today is the Glasgow Coma score. Glasgow Coma score is very confusing topic because we have to remember a situation is given to us and we have to calculate the Glasgow Coma score. So sometimes we get confused between different values. So we have to remember in the Glasgow Coma score. Firstly, we have to remember EVM. E for eye, V for verbal response, and M for motor response. In the eye, we have to remember the ESPN sports. ESPN sports is the very famous sports channel which we used to see in the TV. So in the ESPN, we have to write it like ESSPN. So E for eye, S for spontaneous, another S for speech, then P for pain, and then N for no response. So in the ESPN we have to remember S for the spontaneous, then another S for the speech, then P for pain, and N for no response. Now in the verbal response we have to remember vaccine instead of vaccine. As we know vaccine, so we have to remember vaccine. Vaccine in the V in the vaccine stand for the verbal, O for the oriented, well oriented, C for the confused, first I for the inappropriate, another I for the incomprehensible, and N for no response. So we have to remember vaccine in the verbal response. For the motor response, we have to remember my old fan. As we know fans are there nowadays. So my old fan. So M in my stand for the M in the my stand for the motor, and in the old on the old, O stand for the obey command, L stand for localize pain, D for draw or withdraw, F for flexion, E for extension, and N for no response. So we have to remember my old fan. If in the situation it is given that the patient is intubated, then we have to write V and T for the verbal response. We have to write the V and T for the verbal response, and in the calculation of the Glasgow Coma score, we don't have to add any score for the verbal response. So the maximum score in the Glasgow Coma score is the 15, and the minimum score is 3. Now another topic for today is systemic inflammatory response score and the quick SOFI score. Quick SOFI score is quick sequential organ failure assessment score. So in the quick SOFI score, we have to remember a mnemonic GRASS. GRASS stand for G for the Glasgow Coma score, R for respiratory rate, and S for the systolic blood pressure, and another S for SOFA. So in the quick SOFI, we have to remember GRASS, G for the Glasgow Coma score, S for R for respiratory rate, S for systolic BP, and another S for the SOFA. In the SIRS criteria, we have to remember Stewart. We have to write the Stewart. Stewart we can write like this: STWR Hurt. Stuart. So we have to remember like this. So in the Stuart, S for the SIRS, T for temperature, W for WBC, R for respiratory rate, and heart for heart rate. So it is now easy to remember both the scores. Now we have to remember we have to differentiate between the quick SOFA and the curve score. So we have already seen the trick for the quick SOFA, which is the GRASS. In the curve score, we can remember from the name only. In the C, it stands for the confusion, U stands for the urea nitrogen, R stands for respiratory rate, and B for the BP, and A for age greater than 65 years. So we have to remember in the BP should be less than 90. SBP should be less than 90. In the respiratory rate, it should be greater than 30. For blood urea nitrogen, it should be greater than 19 mg per dl. And all the criteria are given a score of 1, and so the maximum score of the curve 65 is 5. And the interpretation we can see, if the score is 0, then the 0.6% mortality is there. If the score is 1, then 2.7% mortality is there, and the score is 2, then 6.8%, 3 for 14%, and if the score is 4 or 5, then it is 28% mortality. So it is very important for us. Now the next topic for today is the differentiation between the Glasgow Coma Score, Revised Trauma Score, Mangled Extremity Score, and the SIRS. So we have already seen SIRS and Glasgow Coma Score. Now we will see the Revised Trauma Score. Revised Trauma Score is same as the quick SOFA. So we have to remember that GRAS only. In the GRAS, G for the Glasgow Coma Score, S R for the respiratory rate, and S for the systolic BP. In the Mangled Extremity Score, we have to remember psi. In the psi, S for the shock, A for age, I for ischemia, and another I for the injury. So we can remember from these tricks all the score, and they are very confusing when they are asked in the exam. So we have to remember all the tricks and we can easily solve the questions. In the quick SOFI score, from many